Okay, so today what I want to really cover is hypothyroidism, but in particular, exactly what is Hashimoto's disease. Because a lot of my patients are coming in with hypothyroidism and they actually don't have a simple case of hypothyroidism. They actually have a complex case, which is Hashimoto's disease. So I kind of want to explain that so you can fully understand the extent of what's going on in your body. So these are some symptoms if you have Hashimoto's disease here. So you can have weight gain, fatigue, hair loss, anxiety, forgetfulness, infertility, dry skin, brain fog, GI problems, irritable skin. I mean, the list of symptoms that you can have when you have Hashimoto's disease is very, very extensive. And a lot of people don't realize exactly what Hashimoto's disease is. So I want to fully educate you so you can actually understand what kind of problem you have going on in your body. So let's go over this. Exactly what is Hashimoto's disease? So let's just start right here. So Hashimoto's disease is the what? The most common cause of hypothyroidism in the United States. So it is the most common. All right. Now this comes from, you can see right down here where I'm pulling this. This comes from Mayo Clinic. So this is not Dr. Hugh's opinion. This is actual facts. So there's two research articles right here that tell you that the Hashimoto's disease is the most common cause of hypothyroidism in the United States. So then the next question is exactly what is Hashimoto's disease? Okay. So I'm just going to read this. In the United States, autoimmune disease accounts for approximately 90% of hypothyroidism due to what? Due to Hashimoto's disease. So just let me read that sentence again because this is very, very critical that you understand that. In the United States, autoimmune disease accounts for approximately 90% of adult hypothyroidism due to Hashimoto's disease. So this is telling you if you have a hypothyroid condition, that there is exactly a 90%, which is very, very high, probability that you have what kind of a disease? An autoimmune disease called Hashimoto's disease. So you don't have a simple problem of, oh, I have a simple hypothyroid problem. No, you actually have an autoimmune disease. So autoimmune diseases are pretty serious diseases. Like if you've ever seen anyone that has had like rheumatoid arthritis where their hands get all like bent and arthritic and they're hunched over, that's an autoimmune disease. So there's a 90% probability that you actually have an autoimmune disease. So that gets us into the next question, is exactly what is an autoimmune disease? So the way I describe what an autoimmune disease is I like to use analogies, all right? So we're just going to take this picture right here. You're driving, right? Now, is this a very clear picture? Is that driver seeing very clearly? And you can obviously see that he's seeing double, right? He's seeing double, so that's a bad thing. So what happens here is when you have an autoimmune disease, what happens is your immune system has a few too many, what's this? Alcoholic beverages, all right? Your immune system has a few too many alcoholic beverages, and instead of seeing one, just like the driver down here, instead of seeing one, your immune system sees two, or it sees four, or it sees 8, 16, 32, 64, 128. So depending on how tipsy your autoimmune system is, it's going to see more tissue than just one, right? So this is a real critical thing in here. So what happens is when you have an autoimmune disease, your immune system becomes a little tipsy, just like driving too much, because your autoimmune system has had a few too many adult beverages. And I'm not going to go into a huge dissertation on why your immune system sees double or 4 or 8 or 16 or 32. I have tons and tons of lectures on that. I'm just trying to get to a point is if you have Hashimoto's, this is exactly what's happening in your body right now. So let's get to your immune system. So your immune system is always going to be more aggressive than less aggressive. Just let me state that. your immune system is always going to be more aggressive than less aggressive. Friend or foe? Friend or foe? That's what your immune system has to determine every second of the day. Is that tissue friend or is that tissue foe? Friend or foe? Now, what happens is when your immune system has had too many brewskis, too many adult beverages, let's just take your thyroid. Okay, your thyroid is sitting right here, right by your neck. What happens if your immune system is seeing double, or let's just say 4. So your immune system sees 4 thyroids. So your immune system is always going to be more aggressive than less. So what happens is because it sees 4 thyroids, your immune system doesn't know if that's friend or foe, and because your immune system is always going to be more aggressive, it's going to start to what? It's going to start to attack it. So your immune system literally starts to attack your thyroid and tear it apart because it thinks it's foreign. That is what happens in autoimmune diseases. So there's a lot of autoimmune diseases out there. For example, lupus is a connective tissue disease. Your immune system recognizes your tissues as foreign and starts to attack it. Irritable bowel and Crohn's disease, that's an autoimmune disease. And actually, your immune system actually starts to attack your small intestine because it doesn't realize, hey, this is friendly fire, this is friendly tissue. Because it sees 4 GI systems or 8 GI system, it starts to attack it. Rheumatoid arthritis. Your immune system sees your joints as foreign and is going to attack it. Your immune system is always going to be more aggressive than less aggressive when it sees more than one tissues there. So the whole goal in functional medicine is very, very simple at the end of the day. What are we trying to do? In functional medicine, what we're trying to do is we're trying to sober up your immune system. We're trying to make your immune system smarter. Instead of seeing 4, it only sees 1. And then it says, oh my goodness, I've been attacking my thyroid for so many years. I'm going to stop that because now I can see that that is my thyroid because I only see 1 thyroid tissue there. I only see 1 gland instead of seeing 4 glands or 10 glands or 100 glands. So at the end of the day, what we're trying to do is sober up your immune system so your immune system only sees 1 tissue and not several or not 100. And that can be done very specifically through a functional medicine program. And I'm not going to get into the details of what that consists of. I'm just trying to go over exactly what is Hashimoto's disease. Okay, so these are some labs here. All right, so if you look at your labs, your hard paper labs, you're going to see something that says thyroid peroxidase antibodies. You can see this is 900. Like this woman is maxed out at 900. And can you see this lab here? It should be less than what? 9. This little thing, when it says this right here, this little symbol means less. Okay, less than 9. So we want this less than 9. So what is that exactly measuring? So let me go over what this is measuring. So when you have an autoimmune disease, now I'm specifically talking your thyroid. Your body produces these Pac-Mans, all right? These are the Pac-Mans right here. These Pac-Mans represent these antibodies right here. And again, I'm not trying to get really too technical, just simple concepts, simple visuals so you understand. So when you have Hashimoto's disease, this is your immune system, these little Pac-Mans, these are your immune system. And because your immune system sees 4 or 10 or 100 thyroids, it starts to attack it. This is your immune system attacking the gland right now. Okay, it's attacking it. It's attacking it. Now you can measure this, and we measure this by this test right down here, which is called your thyroid peroxidases antibodies. And we want this. What's the key number? Less than 9. Okay, so here's what happens. I'm going to show you some before and after labs of my patients. Let me just clean this up a little bit. Okay, so here we have right here, you can see the date that was taken was November 29th. You see right down here, it says less than what? 9. Now check this out. We first took her test and it was 4,600. Dude, this is crazy. So what does this tell you? This is telling you how aggressive, how many Pac-Mans are going after the tissue. This is a high number. So what this is telling you when we measure this, we can really determine how intoxicated your immune system is. This woman's immune system is intoxicated. I could go on and on and on about her problems. GI problems, constipation, diarrhea, brittle nails, no sex drive, thinning hair, poor skin, not feeling well, chronic fatigue. The amount of problems this woman was having was endless. So then we put her on the specific functional medicine programs, which I'm trained in, and then we recheck. So let's recheck. One thing about labs, I like to recheck because labs don't lie. So here's 4,600, and here we have, it went down to 2,600 in basically 5 months. So this is a huge reduction. So what are we doing with that lab? So what we're doing is we're actually sobering up the immune system and eliminating some of these Pac-Mans on the thyroid, so the Pac-Mans aren't eating the thyroid all the time. Here's another one of my patients. This goes back to 2004. But you can see initially here, let me drive this up. Initially, she was 222. And each of these dots right here, you see these dots? This is when we rechecked. So over a period of time, these antibodies will come down as your body starts to recover. So from here to here, that was about, that's about 14 months to actually start sobering up the immune system to make your immune system smarter. Now, this is what I want to tell you. What the research shows is if you have one autoimmune disease, you probably have 3 or 4 autoimmune diseases in your body. So if you have one autoimmune disease, there's a high probability that you have multiple autoimmune diseases in your body right now. So if you sober up your immune system, guess what? All those autoimmune diseases will start to diminish and go away. Now, one thing I want to talk to you about here is when you have Hashimoto's disease, all right, what happens is your immune system attacks the thyroid. Now, just envision this right here, your thyroid. Envision your thyroid right here as a water balloon, okay, as a water balloon. Now, what happens is these Pac-Mans come, they put a little hole into the thyroid. And then what happens is that little hole, just envision like the water balloon, is going to seep water. And then what happens in your body, you're going to have a bunch of thyroid hormone running around in your bloodstream, right? Like let's say you just were under a lot of stress, you ate a bunch of gluten. So if you have Hashimoto's disease, you need to go gluten-free 100% because that causes more attacking on your thyroid. So let's say you just had a big pasta meal, and you have a bunch of Pac-Mans going on your thyroid, and it's putting little holes in your thyroid just like a water balloon, and there's water seeping out. What happens, this is going to represent your thyroid hormone in your bloodstream. Okay, this is your bloodstream right here. This is your bloodstream. Okay, so when you have hormone, thyroid, I'm going to try and spell this out. It's not going to, okay. Okay, when you have thyroid hormone floating around and you have a huge attack, you're going to have a lot of thyroid hormone. So you can actually feel like you are in a state of hyperthyroidism. Maybe your heart starts to race, or maybe you start to sweat a little bit, okay? Then what happens when this attack goes down, because the attack kind of comes and goes. There's a bunch of Pac-Man, and then they leave it alone, right? It comes and goes. It's not a consistent attack. It comes and goes. Then what happens is when your immune system starts to come down, then what happens, you can actually have, and I kind of covered up the word right here with that little Pac-Man, then you can actually have hypothyroid problems. So you can alternate from hyper to hypothyroid problems when you have Hashimoto's disease. Now, if you've gone to the doctor and your thyroid medication has jumped all over the place, that's a sure sign that you have Hashimoto's disease. Now, why don't the medical profession check this? Because there's nothing that they can do. There's no drug that they can give you to make your immune system smarter, right? So they can't do tests if there's nothing, if there's no treatment for it. Does that make sense? They can't just order tests willy-nilly because you went on the internet and you think you might have Hashimoto's disease. That's not how it works. They actually need justification to run this test. And if there's no treatment to change their treatment protocols, they can't run it. So for example, if you have Hashimoto's disease or not, they're going to give you Levo or Synthroid. That's a standard treatment. So it doesn't matter if you have Hashimoto's or not in the conventional system. Now, functional medicine approach, which is individualized, tailored, custom plan to your needs, is very specific on how we can make your immune system sober up and smarter so it only sees one thyroid. That can be done through functional medicine. I've repeated these tests hundreds and hundreds and hundreds of times, and these techniques, these procedures, the functional medicine works. It's a whole new set of tools, right? It's a whole new set of tools, functional medicine. Okay, so that concludes the talk on hypothyroidism. I hope this has brought some clarity to you so you actually understand what hypothyroid is, and in particular Hashimoto's disease. Because if you have a hypothyroid problem, you have a 90% probability that you have Hashimoto's disease, which is no longer a simple problem, which is an autoimmune disease. In my 18 years, 2 decades of experience, people that have Hashimoto's disease, 99.9% of them have GI problems. If you're not going to the bathroom 2 or 3 times per day with no constipation, no diarrhea, no bloating, no gas, you have some kind of GI disturbance. And in my experience, 99.9% of the people that have come to me that have Hashimoto's, they also have a GI problem. So take care, and I look forward to you getting better.